are done with the face. Let's talk about scalp. Scalp is the cap of the skull. Scalp is made up of 5 layers. The 4 layers extend, it is extending from the eyebrows. When we talk about the scalp, we are talking from this eyebrow. So forehead is included both in the face and the scalp. And it is moving from the eyebrows all the way back to the edge point of insertion of the occipital belly of front occipitalis, and this is the highest knuckle line. So this is the scalp. It is made up of 5 layers. The layers are indicated the name by the artery, by the first letter of each word. S, skin. It is the thickest skin of the body, hairiest skin of the body, and especially the occipital region. That region, that is the one that is having the most hair. And you may see some of the people who tend to go bald, that region is the last one to go, and in a lot of people it survives. So that region, that is called the occipital region, that is the hairiest part. Then cutaneous connective tissue, C for connective tissue. This is the dense connective tissue, and this is the part that contains most of the vessels. Most of the arteries, veins are present in this layer. Don't be fooled by the fact that the loose connective tissue is downwards and the loose connective tissue has more space. Dense connective tissue has the arteries, and that's the reason the dense connective tissue, immediately when the skin breaks, the skull bleeds profusely. The skull bleeds very badly because there is a whole anastomotic network of arteries and veins that is present in this connective tissue. And immediately below it, the level that is layer is aponeurotic layer, that is the same glia aponeurotica, the aponeurosis that was connecting the frontal belly and the occipital belly. Then there is loose connective tissue that basically gives a sliding space for the aponeurosis above. If you place your hand on the top, you can move it like this, and it is moving over this loose connective tissue. All 3 of the upper layers are moving as a unit. The lower one is moving actually, and then we are left with the periosteum of the bone of the skull, that is known as pericranium. And what happens is, when there is a cut to the third layer, that is aponeurotic layer, first the dense connective tissue has a lot of blood, and there is a lot of arteries and veins. Second, there is aponeurosis, that muscle contracts and the space is gaped widely. The A large gap is created. So that gap leads to the arteries remaining open for a long time, and you have to stitch it up to close the profuse bleeding. So what are the arteries? So this is a picture from, I think it was from Vishram Sen, to help you to help you focus on the fact that the deep connective tissue, the dense connective tissue, the second layer contains most of the arteries, veins, and nerves. Okay, so these are all the arteries that you discussed in the face. On the midline, there was near the midline there was supratrochlear. On the lateral aspect, supraorbital. Then the other nerves, the other arteries that we discussed, the lacrimal, zygomaticofacial, zygomaticotemporal, they don't come all the way up, but on the lateral side, superficial temporal artery, it is a major contributor. Just behind the ear, that is posterior auricular branch of external carotid, and on the back, there is occipital nerve branch of external carotid. So these 5 arteries, they come from front to back, and they join on the surface to form a large network that supplies all of the scalp. Keep in mind, this whole network is supplying the skin. It is not supplying, rather, it is not the major supplying factor for the periosteum and the skull below. Even if a person with degloving, sometimes in our country it does happen. A lady was going into the bicycle, her dupatta got stuck in the motorbike, and degloving injury occurred. The hair were pulled, and the skin and all the layers of the scalp were pulled. The one thing that you have to first know, that the separation occurs in the fourth layer, the loose connective tissue layer, the fourth layer. And this means that the blood supply is taken with it. Blood supply is taken in the second layer. But even if that person, the arteries, they remain the skull that remains alive because it is major supply is from the interior aspects, the middle meningeal arteries that are supplying it. The nerves of the scalp are the same one, but a few more branches are there. There on the midline there is supratrochlear nerve. It does not extend beyond the hairline. Then on the lateral aspect there is supratrochlear nerve, usually divided into medial and lateral divisions. It goes all the way up to the vertex. Lacrimal does not come upward, but here is the new thing. Zygomatic-temporal nerve exiting from here, temporal region. It exits up to reach the scalp. Counterpart of superficial temporal, it is known as auricular temporal nerve. Here is the nerve that is going upwards in front of the ear, auricular temporal nerve. On the back of the ear, there is lesser occipital nerve. This is branch of cervical plexus. Auricular temporal is branch of mandibular division of trigeminal nerve. On the back, there are two nerves. That is greater occipital nerve a little laterally and third occipital nerve a little medially and downwards. So this is the spine of the scalp. The scalp itself does not contain any lymph nodes, but it follows the arteries. So near the midline, it will follow to the submandibular nodes. On the lateral aspect, it will follow the superior temporal, superficial temporal to reach the parotid. Behind the ear, it will follow to reach the mastoid. In the occipital region, it will follow the occipital artery to reach the occipital nodes. So this is all about the face and the scalp. Let me take a little breather here, a 2-minute break, and after that we will discuss the muscles of mastication and temporomandibular joint.